Well, when I read this online and in the Herald Leader the other day, I thought I got to call Dr. Kevin Kavanagh because he's the go-to guy for such subjects. Front page of the Herald Leader, I guess it was Monday, the 10th, said Baptist Health ACEs test, but some hospitals did poorly. And we're going to talk about that and also coverage of this story in the Courier Journal as well. Dr. Kevin Kavanagh
thank you, sir.
Is the founder of a group called Health Watch USA, and you guys are kind of a watchdog group.
Yes, sir.
Tell us about it.
Well, we're Health Watch USA. We're a nonprofit organization. We do a lot of work regarding health policy. And one of the areas we've kind of specialized in is hospital metrics. And a metric is a measurement of quality. Over the past number of years, we've had several peer-reviewed publications on infections. We've served on CMS advisory committees, technical expert panels for hospital harm, which develops metrics. And currently I'm serving on the National Quality Forum's Consensus Standard Approval Committee, or CSAC committee, which is the advisory committee which gives the final approval or non-approval for metrics which are recommended to CMS. So I'm kind of in the heart of this, and I can tell you all of these things are very debated. You will hear pluses and minuses on both sides of the issue.
Right.
But what's really hard to find is what is the magnitude of effect of those pluses and minuses. And so we'll try to wade through some of those issues today and see what we can do with getting people to understand these rating systems.
Yeah, because they are very confusing.
Very confusing.
And when you start using numbers, you can kind of make those numbers say what you want them to say.
Yes,
so
I like
careful.
the old saying that there's three types of lies: lies, damn lies, and statistics.
There you go.
Yes.
Exactly. Well, what is the Leapfrog group?
Well, the Leapfrog group is a organization. It's nonprofit. It is a purchaser organization from large corporations. Boeing, IBM, et cetera, have all been ones that have started this group. It is a huge group, and they have a hospital safety score, which they rate hospitals on preventable harm.
Twice a year, right?
Twice a year,
Yeah.
yes.
And so they should not have a dog in the hunt.
Well, that's correct.
Yeah.
They're
They
out
should be
there
impartial.
to purchase good care,
Right.
and they use experts to figure out their safety score. A lot of this is out of Johns Hopkins, very reputable university. And I think it is a reputable score that does reflect performance of hospitals, especially when looked at over time. You'll oftentimes will hear, well, that's just a blip. That's not, that's something that we've taken care of, or that data is old. Well, these scores have been around for years, they should say, but previously we've had excellent scores up until this one blip. But you rarely hear that.
That's interesting.
Because oftentimes the blip is reflected in years of back scores, scoring poorly over the time. And a converse of that is good scoring hospitals. If you go back and search my op-eds in the Lexington Herald Leader, which have over a number of years ranked hospitals, Baptist Health has repeatedly scored high on both the Leapfrog ranking and U.S. News & World Report. And that is an excellent track record.
Now tell us about the U.S. News & World Report.
Well, the U.S. News & World Report is a completely different ranking system. And I am just driven crazy by people saying, but Leapfrog says this and U.S. News Report says that. Well, Leapfrog is primarily looking at errors, safety events, and hospital safety.
Okay.
U.S. News & World Report looks at many different aspects. In fact, their patient safety category has decreased from 10%, which was several years ago, to 5% of their scores.
So comparing the two is apples and oranges.
It's apples and oranges.
Okay.
U.S. News & World Report looks at expert opinion. That comprises 27.5% of their whole scoring category. And in addition, they don't rank all hospitals. So you can find out the good performing hospitals, but it's not very likely to find the poorly performing hospitals. And I think that's very important.
So for our conversation this morning, we're going to be talking about the Leapfrog.
We're going to be talking about, yes, the Leapfrog. And I should also add that I did some quick little correlations on the CMS scores and their patient safety surveys. And one of the questions is, would you recommend this hospital to another person? And this is, in other words, the patient satisfaction, which is really our customer.
Right.
And surprisingly, both scores correlated with that, but the U.S. News and World Report had a higher correlation. So customer satisfaction is different than looking at safety. And that's what Leapfrog is. And it really is apples and oranges. Ideally, similar to Baptist Central, you'd want to go to a hospital that's high in both.
Now, the hospitals that participate in this do this willingly. They don't have to.
That's correct. And just participating in the Leapfrog survey, which gives you the most data, that is a sign that a hospital is very much in tune to making their care safer and doing what's best for the patients. And so I think participation is important.
Yeah.
Just as nurse staffing is important, and participating in the Magnet Nursing Survey, which looks at nurse staffing and work environment. And so that's also very important. So there's a number of factors that patients can go to look at which hospital is best and which they think is a good fit for their problem.
The thing that jumps out at you in the piece in the Herald Leader, that D's, they do letter grades, D's were given to the University of Louisville, Taylor Regional Hospital in Campbellsville, Jewish Hospital in Louisville, which I'd always heard was just the greatest hospital in the world, Highlands Regional Medical Center in Prestonsburg, and Hazard ARH Regional Medical Center. And Kentucky's lone failing grade was the Methodist Hospital of Henderson, which had below average grades in 16 of the group's 28 metrics.
Overall, Kentucky has not done well on this survey. For example, nationally, 32% of hospitals have A ratings. In Kentucky, it's 21%.
Wow.
B ratings, 26% nationally, Kentucky, 19%. D ratings, it's the opposite. 6% nationally have D ratings. In Kentucky, it's 10%. And these ratings do correlate with mortality. The D and F rated hospitals, according to the Leapfrog, have a 92% greater risk of avoidable death. So that it's something that needs to be paid attention to. And certainly that if you have problems with safety scores, you have to really look at your staffing. You have to look at putting in protocols, maybe additional protocols, going the extra mile. Because a lot of times you're dealing with a sicker population. That doesn't mean you throw up your hands and say, well, we're just dealing with a sicker population. Sometimes you have to put in strategies to address that population and improve their health.
Let me ask you this. This came up when we were talking about it on Monday when this report came out. And is there a correlation between nonprofit and for-profit hospitals in terms of the scores?
I think that there used to be a long time ago, but right now most of the facilities are tending to go into more of a cost-driven mode, and even a lot of the nonprofit hospitals are doing the profit route. For example, there was an article out which looked at 22 major nonprofit hospitals, just at the CEO salaries, and that was $3.1 million. So there's a lot of big money in healthcare, and that is one of the problems that we're facing, and one of the problems I feel that needs to get corrected before we could realign resources to really provide the best patient care. Now, that being said, some of the for-profit hospitals in Kentucky have scored quite well. For example, the hospital in Frankfort has a long history of having above average or very high marks. And so just because it's a for-profit hospital doesn't mean that you're going to get bad care. Just because it's a nonprofit hospital doesn't mean you're going to get good care. You really do need to shop for your medical care.
That's really interesting. Dr. Kevin Kavanagh is with us. This is a really good subject and a really good guest to talk about this subject. Let's go to first of all, we'll go to the phones in a second, but our text line, and I think this listener makes a good point, Kevin. It says, we also need info on hospitals and procedures prices, like a price info on those hospitals. Is that ever going to happen?
Realistically, I think no. I mean, It's unbelievable.
Go to a menu, You're
Yeah.
given these you got prices on the menu. If you got a menu that didn't have any prices on it, you'd raise Cain.
Yeah.
Or you wouldn't go back.
That's right. You can get some data now on the overall hospital cost. In other words, their asking price, or what they call the sticker price. But usually if you have insurance, you're not going to pay anywhere near that. But still, those sticker prices do sometimes correlate with insurance contracts. The big problem, I think, is when you go to buy your health insurance, is that you do not know what that insurance company's contract is with a hospital, so you don't know how much you're going to be paying out of pocket at the time you purchase that policy. And that's all protected by non-disclosure clauses. You know, you can't get these contracts out in the open. That was one of the initiatives that President Trump tried to correct, was to make sure that people have access to those contracts so you can make a judgment on which insurance company is best for you to purchase. So you don't even have that information. Once you buy the insurance contract, you can then get comparative pricing, but until then, you're in the dark.
Let's go to the phones. This is Ed. Good morning, Ed. You're on with our good guest, Dr. Kavanagh.
Thanks, Jack. I appreciate the opportunity to do this. My comment, and it's a comment, not a question, is more with the story itself as opposed to Dr. Kavanagh.
Okay.
The 17 paragraphs in the story, 15 of the paragraphs dealt with hospitals that received less than A marks. There were only 2 paragraphs that dealt with hospitals that dealt with A marks. One of those 2 paragraphs was a Lexington hospital. The other paragraph was a paragraph that dealt with about 10 hospitals, 3 of which were regional in central Kentucky. And it just seems to me that it doesn't seem all that fair to focus on the 15 paragraphs worth of low performing as opposed to the hospitals that received an A. Now, let me say that I'm the mayor of Winchester, and I am very partial to Clark Regional Medical Center. That's our hospital. It was one of the hospitals that received an A rating. And once again, it was listed with about 10 hospitals in the middle of the story, and nothing further was said about that group of hospitals that received the A rating. So my issue is not with the rating system or Dr. Kavanagh. My issue is with, if we're going to be balanced in our reporting, we need to talk about those hospitals that performed well as much as those hospitals that did not.
I think you make a great point. Hang on the phone, Ed. What do you say, Kevin?
Well, I certainly agree that one of the big pluses of a rating system is to motivate hospitals to do better. And there's the old carrot and stick approach, and if there's too much stick, you don't get good performance either. You need to obviously always have a good emphasis on good performance and try to reward that through getting hospitals to emulate these good performers. And I think part of the reason why people dwell on the worst performing hospitals is that they sometimes get scared of, do no harm. They want to avoid harm. But you need to realize that when you talk about patient safety incidents that are severe or cause death, although they can occur, it's far less likely to have one of those happen than dying of the disease that you're getting, such as a heart attack, etc., when you're trying to seek competent medical care. So I do think you have a very valid point. I tried to stress the high points in this talk too, and the good hospitals, and certainly looking at performance over time is an excellent way of doing that. I think taking any one point in time can be dangerous because you can have a shortfalling that you've absolutely corrected, but in my experience at looking at performance over time, past performance seems to predict future performance. And that's certainly true with Baptist Central and a lot of the A-rating hospitals, and unfortunately, that's been true with some of the poorer performing hospitals. And some of that, I think, has to do with strategies that just aren't so-called proven, even though they're common sense, that they should be implemented, but they haven't been. And some of these strategies are quite costly, and they can affect hospital performance. And this goes into nursing staffing, and it also goes into screening for dangerous pathogens in patients. And all of this can lead to better scores. However, Not every hospital does that. So these are areas that I think can be improved. And as I stated, overall in Kentucky, our grades are not up to the national average with the Leapfrog safety scores.
Ed, I'm glad that you called, and I'm glad that your hospital got such a good score.
Yes, very
well,
much.
We're
and
very
you guys
proud
should.
of our hospital. It's relatively new. It works hard. They work hard. The staff work hard. They've got a brand new administrator out there that, they just do a great job. And I wanted to state that publicly and on the air.
I'm glad.
So that's
Well,
all I had, Jack.
and that is so important to recruiting business in the community. Some communities have poor performing hospitals, chronically poor performing hospitals, and their business recruitment has stagnated. And one of the problems that I have with the whole healthcare system is the lack of competition. Because if you're in a small community and you've got a bad hospital, well, you just got a
What are you
bad
gonna do
hospital.
about it? Yeah.
You can't do anything about it.
Yeah.
The state has a CON law that prevents new hospitals from coming in, and I think that needs to be repealed.
Dr. Kevin Kavanagh is with us this morning. We're talking about the ratings, specifically health ratings of the hospitals in the state. Let's go back to the phones. And this is Jan. Good morning, Jan. You're on with Dr. Kavanagh.
Good morning. I tuned in late, so I wanted to find out where can I find these hospital ratings?
Well, the CMS or government hospital ratings can be found at Hospital Compare. The
Hospital Compare is the website?
You need to Google Hospital Compare. It's
Okay.
the government. They don't have an easy
Okay.
web name.
Okay.
What can I tell you?
Just Google Hospital Compare.
And
Okay.
you can identify that. The Leapfrog group is Leapfrog Hospital Safety Grade, or you can just put in Hospital Safety Grade, which will pull you in, or the URL is hospitalsafetygrade.org, all one word. And that's the safety side at U.S. News and World Report. Just Google U.S. News and World Report. And again, the Leapfrog group is patient safety. U.S. News and World Report looks at kind of the entire picture of the hospital. Not all hospitals even make the rankings or even get considered. And there you're looking at more, I've got a serious problem that's a difficult problem. Where do I want to go? The patient safety score is, you can have a difficult problem, but still screw it up over something very simple. So you want to be sure that you look at both scores, but they complement each other. They're not supposed to be the same.
That help?
Which one would have more of the Lexington Hospital?
Well, they both have Lexington hospitals.
Okay.
Yeah.
Okay.
Yeah,
They're
Lexington
statewide. They have
hospitals.
all the hospitals
Yeah.
that participated. Did all the Lexington
Okay.
hospitals participate in the Leapfrog?
Well, they're all listed on the
Okay.
safety score.
So they
yes.
must have.
Yes.
Thank you. Here's a text that came in on our Scheller text line that says because the mayor of Winchester
Yes.
called, pointing out the Clark Regional was an A rating on the Leapfrog. It says, I spent a day and a half in Clark Regional. My bill was $16,000. Did they get an A on ridiculous pricing? Well, he's got a good point. Of course, it doesn't say what happened in the day and a half.
Well, it does, and
but
what
this
type of
actually
insurance, but this is common.
Totally separate, too.
Yeah, it's a separate issue, and the prices are totally common. As an organization, we've kind of drifted away a little bit from the financing issue because it's so out of control. I mean, what can you say? I had a test that took 2 hours. It was a radionuclide cardiac test, and the bill was over $20,000. That was the asking price. So it's absolutely ridiculous at this point. It's out of control, and I mean, what can you say about it? And people are going bankrupt over this. And this is one of the drivers of, I feel, of this socialistic movement and of socialized medicine. And the defenders of the free market system need to get going, and they need to do some excellent reforms. Even in Kentucky, we don't see this. Even though it's vastly controlled by Republicans, we don't have good price transparency. We don't have good transparency and timely reporting of quality problems. We have large oligopolies, which is kind of like a monopoly where you don't have the entire market, but you have enough to really make a price difference. Still have a certificate of need, meaning you can't just go out and buy a hospital. And we need protection of physicians so that they're sure that they're doing the right thing for the patient. Right now, their primary responsibility is to their employer. They can get fired. They could have a non-compete clause in their contract or even a being fired without cause. type of a clause in their contract. And all of these protections need to be put in. If you want a free market system, you need to start to have that, because right now we don't. We essentially have an unregulated system that has oligopolies, and the prices are going out the roof. And this is something that needs to be corrected. Right now, it is a huge problem, and I think it's one of the driving forces of the social change that we're currently seeing.
Going back to this Leapfrog rating system that we started out with here, and we wanted to talk about, what are the areas that are graded in this Leapfrog survey?
Well, the Leapfrog survey grades, as I said, safety scores. For example, something's retained, a foreign object's retained, that's graded. They're looking at mortality. They also look at infections. And one of the big differences between the Leapfrog and the U.S. News and World Report is U.S. News and World Report does not look at infections. And if you have listened to any of my radio shows or my op-eds, have read those, you know that that's a area that's dear to my heart.
That's
and
huge.
So right now I get biased over not listing that. U.S. News and World Report says, well, that data is not as good as it should be. And my response to that would be, it's pretty good, but there's problems with all data. Even the expert opinion data can be scammed a little bit. I mean, I received a letter from my alma mater encouraging me to log on and vote for them with U.S. News and World Report for the expert opinion part of it. So everything can be scammed, and all these organizations try to put in controls to prevent that. For example, with infections, currently it's laboratory data. In other words, it's not a judgment on whether or not an infection's there. It's if you have a positive culture after 3 days of being in the hospital, that's considered an infection. And so a lot of effort has gone into trying to make these metrics more valid. And this is something that's not new. It's something that has been around for a long time, this concern about validity, and a lot of things have been done to address that. And so I think that these scores are more accurate than not. Certainly there can be an aberration, and again, so looking at scores over time is what is best.
What are the infections that you are speaking of, just in case
Well,
somebody's wondering?
the infections right now that are being tracked are severe MRSA infections that affect the bloodstream, C. difficile infections, which is the severe infection of the GI tract, urinary tract infections, and also infections of large treatment lines that are put into a person's body. And these are pretty good. However, there's problems. Number one is the really deadly bacteria, such as Candida auris, CRE. There's not a mandatory reporting system federally, and there's not good transparency. And there's also a delay in making the data available to the public. And you'll oftentimes hear this, it's old data. Well, the data covers at least a year span. Some of the data is older than others, but a lot of the data is 2017 to 2018, which isn't horribly old. But for infections, you'd like to have data what happened last week.
Why isn't it appropriately tracked?
Personally, I think
they don't have to, right?
It's simply politics and political pressure put on these agencies. HealthWatch USA participated in a New York Times report that looked at a timely reporting of a resistant pseudomonal infection from a Mexican hospital and all the alerts issued. And this was weeks ago. It occurred a few weeks. Suddenly the CDC reports out. But to find those type of infections, for example, a CRE infection in the United States, you're looking at a year and a half delay. And guess what? The CRE infection is much more dangerous than the infection in Mexico. The New York Times report even used a safety report that was generated from Kentucky as an example of CRE reporting, because we do have an excellent health department that's at least collecting data, and hopefully they know about it more timely than I do. We are generating at least some of the data internally, but it's not made readily accessible to the public.
Now, I want to go back on something that you said, and maybe I misunderstood. On these common infections like MRSA and C. diff and UTIs, did I hear you say they're doing pretty good? Because I didn't think I'd ever hear you say that.
Well, as far as the validity of the data goes, they're doing better. But there's a lot more way to go. They need to be more timely.
Okay.
And the MRSA infections, personally, I feel should be all infections, shouldn't just be the severe bloodstream infections. And even at that, we've got hospitals that have a large number of patients that are getting this infection. And I think instead of risk adjusting this away, saying we have sicker patients, we need to start doing screening of these patients and making sure that they don't get the infection. In other words, go the extra mile.
Here's a text that says, can the doctor discuss emergency room ratings and issues in Lexington?
Well,
Are they in this Leapfrog? Are they separate?
Right, no, you can't separate them out. They're just lumped in with the hospital.
Okay.
And there's a lot of problems with the ratings. There's also a problem that there's not many outpatient-centered ratings. And that's a big problem because the surgeries are now being shifted more from hospitals to outpatient centers.
Right.
Some people think it's to try to avoid accountability because there's very little ratings or supervision of those centers. And so that's a problem. And then you get into the nursing home issue. And again, very little reporting on infections or even guidelines on how to prevent them in nursing homes.
Here's a text that's interesting. Opens a new can of worms. Let me see. Where'd it go? Some nursing homes seem to get lots of infections. Are they rated?
Well, yes, there is a nursing home compare site where they are rated, but the infection ratings are basically not there. They dropped off MRSA last year. They quit following it. It is a huge problem. And it's also a problem on how do you control the spread of infections in nursing homes.
Yeah. It's almost impossible once one starts, right?
Yeah, it is. I mean, do you lock people and isolate them in their rooms for the rest of their lives? What do you do? And so this is something the CDC is trying to address. It is a problem, but it's not an easy problem to overcome. And personally, I feel you have to look at the nursing home as a whole. In other words, know what the carriers are of everybody in the nursing home and treat them as one microbiome rather than looking at individual people or residents. But even that is going to be extremely difficult. And this is one of the reasons I've said this epidemic of multi-drug resistant organisms affects not only hospitals and our standard health care that we have, but nursing homes. It may be completely detrimental to that system, and it may actually result in its undoing, where being in a nursing home may not even be safe. Now, I'm not talking about now, I'm talking about in the future if this epidemic is not controlled, because these patients are sick in the hospital. They're many times elderly. When they get transferred into the nursing home, oftentimes they will spread these infections, or they can acquire an infection more easily from someone from the outside. And then once in the nursing home, it spreads like wildfire. Because, again, the residents, it's
fragile
like,
population.
Yes, and it's like daycare in some respects.
Yeah.
They don't always wash their hands. They don't always have good hygiene. They're elderly. They're getting into their second childhood, as Shakespeare once described. And so it becomes extremely difficult, and it is a huge problem. And I wish I had a good solution to it at this point, but it's one of the reasons why I stress so much that we need to be tracking these multi-drug resistant organisms, using antibiotics wisely, not overusing them, and this is the only way we're going to get ourselves out of this.
You mentioned a moment ago there is a comparison site for nursing homes, even though they don't specifically talk. What is that?
Well, it's Nursing Home Compare. It's with the federal government. They do have some data on staffing, which is good. You're going to have to Google it. Again, being the federal government, the URL is too complicated.
Too
But if you do Nursing Home Compare, you'll go right to the site via Google.
Okay, but there are staffing is addressed?
Staffing is addressed, and there are some issues that are addressed. And certainly I would search that data to make sure that you're in a good nursing home. And I need to add that staffing, I think, is one of the most important things to be looked at. And that's why the
Amen, brother.
Yeah, that's why that's such an important metric on Nursing Home Compare. And that's why looking at the Nurse Magnet Award or designation is extremely important, which, by the way, many hospitals have that. University of Kentucky has a magnet designation in Lexington, so does Baptist Health Louisville, Frankfurt Regional Medical Center, St. Elizabeth's, and Baptist Health Lexington all have that. designation, and I think that's very important
What does
because
that
it means they
mean
have.
exactly?
Well, it's started by the American Nursing Association. It makes sure that you've got adequate nurse staffing, not only in numbers, but in training, in good working environment, and all of that has been shown to be highly related to both medical errors and problems with infections. So it's an important component in this.
I appreciate you being here today. It was a timely program. If people want to learn more about HealthWatch USA, how might they do that?
Go to the website, healthwatchusa.org. We also have an October 17th patient safety conference that you can look at, and we'd love to have you attend it, and that's at healthconference.org. All one word.
Thank you very much.